Hello, this is Fadi Al-Fayoumi, and this is my final presentation at the MBA program at Washington State University under the title of the Vein Clinic Service at the Heart and Vascular Clinic. We will go over the presentation in terms of summary, go over the company overview, industrial analysis. We're going to talk about customer analysis, competition analysis, marketing plan, social responsibility of the company, along with some financial plans. Now, what we are introducing here is a vein treatment, a new company which is a service treatment of varicose veins and vein disease at an already existing clinic, the Heart and Vascular Clinic, which is specialized in the treatment of cardiovascular problems. Under normal circumstances, the functions of the veins is to drain blood back to the heart against the effect of the gravity. This is being accomplished by the action of heart valves, the function of which is to allow the blood to go in one direction but not the other. If those valves become non-functional for one reason or another, like pregnancy, trauma, or genetic reasons, the vein becomes distended, congested, or swollen. Eventually, that can lead to varicose veins, which can lead to edema or swelling of the legs, development of spider veins or network-like appearance in the skin like that, which people call them varicose veins, but they are called spider veins from the medical standpoint. The problem can be the fact that those varicose veins can lead to inflammation in the skin, and they can cause ulceration that can eventually end with amputation. So varicose veins is not essentially a benign disease or only a cosmetic disease. It's a problem can lead to disastrous outcomes. The treatment in the past used to be surgery, where under the assumption that one big vein in the thigh will be responsible for all the problems, surgeons will make a big scar in the thigh and take the vein out. Unfortunately, this treatment was expensive. This treatment was ineffective 40 to 50% of the time, and this treatment was not satisfactory for the patients because they will come back with the same problem despite the big scar tissue and lack of any cosmetic goal achieved. The new technology, especially the development of ultrasound technology, allowed us to understand vein problems and vein diseases and come with a new technology for the treatment. Nowadays, we are using endovascular laser treatment, where without surgical incisions, without scar, we can introduce laser catheter inside the vein responsible for the problem and do something called ablation, where the vein is closed down under the skin, so it's not distended anymore, and therefore the problem can be taken care of. This is done by the effective application of a heat inside the vein wall, so the vein wall will collapse upon itself and there is no blood inside the vein. We also can do something called phlebectomy, where it's through micro-incision, those bulgy veins under the skin can be taken out immediately without leaving any major scar tissues, and eventually the treatment can be complemented by applying sclerotherapy, where the very superficial, tiny, hairy veins under the skin can be injected with an agent that can lead to closure of those veins and eventually achieving good cosmetic results. Stuff like that, where the patient can present in to the clinic with distended veins, edema, swelling, and sometimes even ulcerations without surgery, with no knives. You can start with something like this and end with something like that, where the expense is not that major according to Medicare and Medicaid and Blue Cross Blue Shield and private insurance criteria for expensive treatment. And the patient will leave very satisfied because the problem has been taken care of without surgery and ending with very cosmetic results, and we have prevented any major clinical disasters. So now we're going to go over the company overview. Now, it's very important to understand that the understanding of vein disease problems and the effective treatment became available only over the last 5 to 10 years. In medical school, there is no adequate training in management of vein conditions. In fact, there are no specialty called treatment of vein disease in medicine yet. This goes under surgical intervention, vascular surgeons, or cardiovascular surgeons. They do what we call it surgical excision of the vein across the thigh, under the assumption that there is one vein responsible for all the problems. It's the introduction of the ultrasound technology that make us understand that vein disease is very complicated. And if you want to actually treat the condition, you have to have an extensive training by the experts in the field which is very difficult and very expensive. So most of the vein clinics in the nation are actually operating under a spa principle, which means the patients will walk in there and they will show up varicose veins or spider veins, whether they're big or small. If they're big, they will make a small incision and take them out. And if they're small, they will apply the local sclerotherapy. They do disappear upon the treatment immediately. The problem is they come back. So the service was never delivered adequately and the customer satisfaction is not there. And if you want to provide both these goals, then you have to have an extensive training. Most people don't have it. Now, when it comes to the vein clinic that we are proposing here, the service that will be offered will be a full consultation by the expert doctor to explain to this patient why does he have varicose veins and why the varicose veins that he has might be completely different from the varicose veins his sister or his mom had. We're going to apply the Doppler sonography to precisely define what vein is responsible for this patient's particular problem, and based on that we will decide on the best mode of therapy: sclerotherapy, laser therapy, or phlebectomy. Those are medical terminology, but the point is we will target the therapy based on the findings of every single patient. There is no one treatment fits all. There is no one technology being applicable to every single patient or customer. Everyone will be individualized, and that's going to be the difference in our service compared to the other when it comes to the way we are applying the therapy. It's called the comprehensive approach. It's going to be based on history, physical exam, Doppler findings, and discussion with the patients about the therapy. Now, when we talk about industrial analysis, the US healthcare market remains one of the most attractive healthcare markets in the globe. Reason being is that we don't have socialized medicine, at least yet. So we are still operating under the fee per service. More volume, more income, more overhead, more business strategy with that. If we talk about the trend in the healthcare in the United States, there has been more trends toward cutting expenses. The most expensive bills in the healthcare in the US come from the hospitals, not from the outpatient clinics. And therefore, there has been a recent trend toward doing more outpatient procedures. Since we're doing our procedures in the clinic, we are avoiding the big surgical incisions. Remember, we talked about this in the past, in the initial slides. No more surgeries, no more anesthesia, no more OR, no more long hospital stays. It's going to be an outpatient endovascular ablation. The patient will walk in, get the therapy done if that's what he needs, and then the patient can go home immediately after that. So the therapy will be less expensive, and insurance companies, including government insurance companies like Medicare and Medicaid, are pushing for more outpatient, safe, less expensive, more effective procedures like the one we're applying here. We are expecting the growth to be significant in this field because there are so many underdiagnosed patients. If we look at 2012 statistics, there are about 3.8 million vascular procedures with a revenue of about 1.7 billion in 2012, and we're expecting that to grow at a rate of 2 to 3% annually, and that's a very conservative measure if we don't include the underdiagnosed patients. So overall, when we look at the industry analysis, when it comes to this particular field, it seems to be very attractive and lucrative. When we look at the customer analysis, the vein clinic will initially operate in the area of Brownsville, Texas. 90% Hispanics, Americans, 250,000 total population. That's not including the Matamoros, Mexico population, which frequently come to the US and they shop and they seek medical attention and treatment in the United States. They're cash payers. It's very difficult to precisely estimate how much revenue or what percentage we expect from those people. But roughly, looking at the statistics of the heart and vascular clinic, 10 to 15% of the patients are cash payers, and they do pay for that. So we're expecting a similar figure to that when it comes to the cosmetic or to the treatment of vein problems. Now, we will come to the competition analysis, and if we look at the bigger picture of that, even though the clinic will operate in Brownsville, Texas, we probably will attract patients from Harlingen and McAllen. Then we might be talking about a population of about 750,000 people eventually in the near future. So if we Google the area and look over vein clinics treatment or vein disease treatment, we find three other clinics where the treatment with sclerotherapy or varicose veins removal or phlebectomy is offered in two clinics in Brownsville and Harlingen area and McAllen area. One actually in Brownsville, one in Harlingen, one in McAllen. But if we look at the type of the training and the type of the service being offered by those clinics, it's not the comprehensive approach. It's actually the spa methodology. They're actually offering other cosmetic treatments at those clinics, and most of them are done by medical assistants rather than by the physician himself under the supervision of the physician. Since they are not using the comprehensive approach, the treatment is never 100% effective, and therefore there is a lot of recurrences. So if we look at the way we are applying the new method for the treatment for varicose vein disease or vein disease in general, we truly do not have any real competition. But initially, at least, we're expecting to be competing with three other clinics in the area. Our marketing plan is extensive. That's going to involve a lot of methods. The main one will be informing and educating the referring primary care doctor about our services, and that's going to be by the doctor who's going to offer the varicose vein treatment, visiting those doctors at their clinics and giving seminars about vein disease. The word of mouth by the patients, including those patients who are already an existing patients for the heart and vascular clinic, and the patients who are going to be treated by us. We're also going to be using advertising through a special mail by Googling and using a special software offered by the hospital to define who has been seeking attention and treatment for varicose vein disease or vein disease in general, and send them special mails about the service offered by the vein clinic being developed in the near future. Now, when it comes to the operation and technology plan, the vein clinic service will be offered at the heart and vascular clinic. We're going to be using the same office and the patients will be referred to the same office. The only difference is that now we are offering a new vein treatment service. A lot of our already existing patients as cardiac patients or vascular patients will come to this clinic, again being referred for the new service for the vein treatment. The technology plan will include applying the electronic medical records so that the patient's pictures can be taken before and after the treatment, and the accuracy of putting the records in there will be high based on the insurance requirement. We are going to buy the vascular machine. We're going to buy the laser catheters, and that will be through the joint venture with the hospital, and we're going to rent those equipments from them. The initial cost will be in the range of $60,000 to $70,000. And the quality control will be based on guidelines issued by the Cleveland Clinic and the Mayo Clinic, which are considered the center of excellence in the nation for the treatment of vein disease and based on their outpatient criteria. When we talk about inventory control, we're going to buy equipments, especially when it comes to the laser, gloves, gowns, and materials, initially enough for the first 10 patients. And after that, it will be based on appointments. So it's going to be based on demand, and that will give us a very good control over our inventory, at least a flexible part. And with regard to the labor requirement, we have 3 medical assistants who are very well trained in the field of vein disease. And eventually, when the service grow up and we have enough patients, we're going to be looking at hiring a nurse in the field who is going to provide the comprehensive approach introduction to the patients, the treatment discussion for the patients, and then the doctor will assist in the process of the treatment and the follow-up after that. When we look at the organization itself, the president will be myself, Dr. Fadi Al-Fayoumi. The cardiology service will include the nursing staff. We have ancillary service in the clinic, which include the vascular lab that includes the ultrasound machines to look at the blood vessels and the heart, the technicians who are doing those ancillary services, and eventually that comes here, the vein clinic service with the nursing staff who are going to be very much the same staff for the cardiovascular clinic who are very well trained in the treatment of vein disease, in addition to the new hired nurse in the near future. The vein clinic is obviously offering a medical service, so that social responsibility of the clinic is very obvious. And therefore, when we talk about the finance of the clinic, we are looking at a very conservative measures and figures. Endovascular ablation reimbursement is about $1,500. Phlebectomy is about $500, and the sclerotherapy is about $350 per session. Each patient will require 3 to 5 sclerotherapy sessions, starting with 2 patients on a weekend we're looking at image